Hi, this is Ayan Kim, and this is my presentation on tuberculosis. We're going to look at four things in our tuberculosis presentation today, and that is disease prevalence, and this will be examining in two sections, geographical and ethnic prevalence, and then second, causes. We'll be examining a couple of risk factors of tuberculosis, symptoms, diagnosis methods, and then pathophysiology, as well as treatment, which drugs are used, and the duration of the treatment, as well as the clinical significance of tuberculosis, as well as its history. Now, tuberculosis is a significant global health risk, and the reason for that is because it's currently estimated that around 1/4 of the world's population have latent TB, and an estimated 10.6 million new cases occur annually, and 1.5 million tuberculosis triggers deaths are reported annually, and this is approximately equivalent to 134 incident cases per 100,000 population, and this is from the World Health Organization's TB incidence data. Now, the risk of tuberculosis isn't exactly just circumscribed to one geographical region, but there are a number of areas that are identified as high-risk zones, and this is mainly Southeast Asia at the moment. Southeast Asia, I think, is responsible for around 45% of all of the global TB burden. Following that is Africa, responsible for 24% of all global TB cases. Following that is Western Pacific region, reporting around 17%. In terms of the distribution of the global TB burden for nations, India is currently accountable for around 27% of the global TB burden, and despite certain efforts in order to curb the TB incidence rate, tuberculosis still remains high in India. In terms of looking at the ethnic prevalence of tuberculosis, because it's termed as a disease of poverty, it's definitely much more present in countries and certain ethnic groups where it's a low resource setting, and as of 2023, 90.1% of all TB cases in the US were among ethnic minorities, and worldwide, Hispanics and Latinos report the highest proportion of tuberculosis cases at 36.8%, and this is followed by non-Hispanic Asian persons at 30%. Next, we'll be moving on to the causes of tuberculosis. Now, tuberculosis is an acquired infectious disease, and it's caused by aerobic rod-shaped bacterium named Mycobacterium tuberculosis. And the primary way of transmission of tuberculosis is via airborne droplets, and this is usually released by an infected person when they are sneezing or when they're coughing or just simply talking. And when the TB droplets are inhaled, the bacteria infects the lungs and it causes pulmonary tuberculosis. Now, when tuberculosis spreads to other regions of the body, we call that extrapulmonary tuberculosis, and when it infects other regions, like for instance the brain, we call this tuberculosis meningitis. A couple of risk factors of tuberculosis include maintaining close contact with infected individuals, having HIV. Other factors like malnutrition, smoking, and diabetes definitely contribute to causing tuberculosis. In terms of the general pathophysiology of tuberculosis. Now, upon entering the lung, the tuberculosis bacteria is phagocytosed by alveolar macrophages, and then the bacterium avoids death and destruction by using a waxy cell wall and inhibiting the phagosome-lysosome fusion, and then this triggers the sort of TB multiplication, and then that in turn triggers a more immune cells to kind of move towards that infection site, and this creates what we call a granuloma. And if that granuloma contains the infection, the patient then proceeds into a phase of latent TB, which is asymptomatic. However, a weak immune system can trigger bacterial reactivation, and this might result in active tuberculosis. A couple of symptoms as well as clinical manifestations of tuberculosis. It really differs on what type of tuberculosis it is, whether it is pulmonary tuberculosis or whether it is just extrapulmonary tuberculosis. But a couple of common symptoms for both of them include permanent coughs with cases of coughing up blood even, or chest pain, fatigue, weight loss, etc. Now, there are a range of diagnosis tools for tuberculosis, and it really is centered around identifying whether a patient has latent or active tuberculosis. A couple of those tuberculosis methods include a skin test or even a chest x-ray in order to identify certain lesions, typically in the upper lobe, and those are a couple of diagnosis methods used in order to detect TB. General treatment methods involve prescribing multi-drug antibiotic regimen over a span of around 6 to 12 months. And specific medications really depend on what type of tuberculosis it is and the general severity of the illness, as well as the drug resistance of that specific TB strain that's infecting the patient. A couple of common drugs that are used include the following. Now, the reason why tuberculosis is so important, it really divides into a range of reasons. One of which is that it's a deadly killer disease. It's much more deadly than diseases like HIV or malaria. And as I have mentioned earlier, in 2023, an estimated 1.25 million people had died due to tuberculosis. And an average of approximately 10.6 million new people are infected with TB on an annual basis. Now, also one other thing about TB that we should definitely note is that it's much more prevalent among low-resource settings, among people who are ethnic minorities or immunosuppressed individuals. They are particularly much more vulnerable to TB. And given how tuberculosis is a poverty disease, and because it's just disproportionately affects certain individuals, whether it can be low-income individuals, ethnic minorities, or immunodepressed individuals, that makes it a major public health hazard today. Now, diving into the history of tuberculosis a little. Now, tuberculosis was discovered on March 24th, 1882, and it was discovered by Dr. Robert Koch. And his discovery was that this bacteria called Mycobacterium tuberculosis was the causative agent for tuberculosis. And he continued working on that, and that later led him to receive the Nobel Prize for Physiology or Medicine in 1905, March 24th, for his work, and now this day is annually recognized and commemorated as the Tuberculosis Day.